Thank you very much for your comment. I agree with you that it can be really difficult to impress a person who's really depressed because they've lost the ability to experience pleasure in things that were previously pleasurable or in activities that are generally pleasurable. And so that can be a very sad life to live, especially if the loss of pleasure is throughout the day, every day, and in most or all areas of their life. So you can see this person is able to experience sadness but cannot experience happiness or positive emotions. Now, looking at the remedy, I would say the first thing is to identify the problem, but more specifically to identify if there is a problem. What I mean by this is there's a need to distinguish life challenges, which are normal, from symptoms of a mental illness, which are abnormal. So from time to time, we do face challenges, difficulties in life, and we're still able to function on a day-to-day. So you're going through a breakup, or you've lost your job, or you've had to move to another country or another city, and that is very difficult on you, but you're still able to sleep well, your appetite is still good, your level of activity is still okay, your thoughts, you still have control over your thoughts and how to focus and concentrate, you're still able to socialize and make new connections. So despite the challenge, you're still able to cope. That is normal. Symptoms of mental illness share similar characteristics. So a person might be going through something challenging. Not all mentally ill patients experience challenges, but if we're using the context of challenges in this particular discussion, then I would say a person might be going through a breakup, or they've lost their job, and that difficulty is so overwhelming that it compromises their resources. And so this person is finding it difficult to eat, is finding it difficult to sleep, is finding it difficult to shift from one thought to another. So they tend to have these repetitive negative thoughts, maybe about themselves, maybe about somebody. So the difficulty is impairing their ability to function. So that becomes a symptom. So for example, a person who's gone through a breakup, that's a normal life challenge. They're experiencing sadness, but they know that the sadness they're feeling is the normal amount. They're able to validate their emotions in that particular experience. They know that it will take some time before the sadness goes away, and they know that they can do things to reduce the sadness or to experience a different emotion. Same person, if they're presenting with a symptom of a mental illness, it would mean that the sadness they're feeling is disproportionate to the breakup. And the sadness is so overwhelming such that they're unable to go to work. They're unable to go out and socialize with other people. So then that becomes a symptom of a mental illness. It's now making it difficult for this person to function, for this person to make their positive contribution to society by going to work and to cope with the challenges. So now they're unable to move every day, every week as you come away from that breakup. There should be a difference in the way that you experience the heartbreak. But for this person, it's just as fresh as the first day, as the first week. And so you can see this person is stuck in that emotional experience. They're not able to cope with it. And so another thing is this person might start getting into maladaptive coping mechanisms, like using substances, let's say alcohol or cannabis. And so then, yes, this person has symptoms of a mental illness. So number one, it's really important to establish that there is a problem, that the problem is a symptom of a mental illness. And then once you have the symptoms, then you might start thinking, oh, this looks like depression. And then the next question is, what type of depression? Because we've got different types of depression. And then if it's major depressive disorder, it's got subtypes. Major depressive disorder is usually what we call depression. But then there's also premenstrual dysphoric disorders, particularly affecting women, and other types of depression. Now, if it's major depressive disorder, especially in this period when it's cold and the sun comes out rarely during the day, then people are more likely to be affected by what we call seasonal affective disorder and a major depressive disorder. It's also here that you might diagnose postpartum depression. Now we call it peripartum because if a woman gets depression during pregnancy up to 1 year after delivery, then it's peripartum. It's here also that you find MDD, major depressive disorder with psychotic features. So a person had depression and then now has auditory hallucinations, persecutory delusions, paranoia. And so this person might be confused for schizophrenia. And so it becomes really important then to nail the diagnosis. And even after you've said, okay, this is MDD, seasonal affective disorder, then what is the severity? Is it mild? Is it moderate? Is it severe? And then once you're able to get that scaling, the severity, then guidelines, clinical guidelines are very helpful at telling you that a person with moderate depression benefits from both medication and psychotherapy. And the guideline says that for people who are depressed, they need both, in terms of psychotherapy, they need cognitive behavioral therapy to restore their thinking so that it can be more logical, more realistic, more accurate, more rational, and interpersonal therapy, meaning the relationships they're in could be perpetuating the symptoms of depression or might even precipitate depression. And so this person might require a combination of psychotherapy and medication, pharmacotherapy. So here we're talking about SSRIs, SNRIs, and other types of antidepressants. Yes, so I would say the first remedy is to first distinguish whether this is a normal life experience and you're expected to, by life, to endure this difficulty, this challenge, and it's going to push you, it's going to push your limits, and you're going to be able to expand through that experience. You're going to be able to build resilience in that experience. And so then you might not need to see a psychiatrist in that case. But if it's impairing your ability to function, then you need to see a psychiatrist. I would say the first person that you need to see is a psychiatrist.